For 30 years, Queen Square Enterprises has been providing state-of-the-art scanning facilities to both private and NHS patients.
Over the last 30 years, QSE has made great progress and the prospects for the future are extremely good.
Set up in 1985, when the NHS was unable to afford new life-saving equipment for its leading neurological hospital, the National, Queen Square Imaging Centre has remained at the forefront of technology since purchasing one of the first MRI scanners in London.
Two things were absolutely certain, that we had to have this scanner if we were going to remain anywhere near the forefront of neurology, and that there was no money for it. I mean, that was basically what happened. The first thing was to find the money.
In 1984, the National Hospital couldn't afford to buy the latest bit of innovative kit, an MRI scanner. So the very go-ahead general manager, Anthony Wheatley, and a colleague formed a company and bought the scanner, and the scanner was allowed to be used for private patients, and they generated sufficient income so that there was surplus capacity on the scanner for the NHS.
Queen Square Enterprises soon joined forces with UCLH Charity, and working as the UK's first health sector social enterprise, was able to directly inject profits from private patients back into the NHS and UCLH's group of hospitals.
The model gives an incentive to the referring consultants as the benefits of the private patient activity flow through via the charity to the National Hospital to support medical equipment research and clinical developments.
The QSE is a wholly owned subsidiary of the charity, and they, through a mix of private patients and NHS patients, are able to pay a dividend back to the charity every year, which is approximately £1 million a year. There's a huge range of grants that we will make, and it could be anything from a new scanner for a couple of £1 million, right through to something as simple as, but as important as an annual grant towards the nurses' Christmas ball, because the staff work so hard.
It enables the consultants to remain on site to provide the service, and it gives them an encouraging link in that all the profit that's being generated is ploughed back into the NHS.
The financial model of QS Enterprises has been a great success, and with the current uncertainty facing the NHS's future, those at Queen Square hope this model can now be looked to for inspiration by similar organisations.
The QSE model, I think, is really very inspiring to the rest of the NHS, and particularly now when we're under great financial pressure. Within the somewhat gloomy environment of the NHS today, I think QSE is a particular bright spot where what they've done so far is giving them a great platform to go forward in the future and put additional machines into different locations and provide this very classy service that they provide to ever more patients.